It's time for live chat. The Psyche Truth live chat. Every Wednesday at 3 p.m. Central Standard Time on your YouTube machine. Live chat. Live chat. Answer your questions about whatever you want to talk about. The Psyche Truth live chat with Dr. Jeff Echols.
Well done. Excellent.
Thank you all so much for joining us on the Psyche Truth live chat. We are here every Wednesday at 3 p.m. Central Standard Time, and I want to thank you for being here. So we have some questions that have been asked on the Facebook. We're going to answer those, and then I also encourage you to leave your questions below, because we're actually going to be answering your questions live and on the spot, as we say. So I want to give a little what's up. We've got Jonathan in the house. Deadlift, Etienne Burton is in here. Thank you all so much for being here. We are very excited. I want to take a brief second to remind you about our website, psychetruth.net. I'm going to give it to you. It's coming. Here it is. Psychetruth.net. Please, if you haven't yet, go to psychetruth.net. Sign up for our email newsletter. It's the best way to make sure that you never miss out on one of our videos. You get all of the great updates that we will have for you. So again, psychetruth.net. Thank you so much. And I'm joined today by Dr. Jeff Echols. Thank you for being here.
That's always fun.
How are you doing?
I'm wonderful. Thank you.
Excellent. So as most of you probably know if you watch our channel, Dr. Echols is a chiropractor. And he has made a whole lot of different videos talking about chiropractic work, actually demonstrating different adjustments. So today our topic is pain and chiropractic. So there were some questions, as I mentioned, left in the Facebook. We're going to start with those, and then we will get to y'all's questions, which are already piling in. So thank you so much. All right, so on our Facebook post, Amanda Alice Ames has asked us some questions, and what she says is, I was wondering, is it possible to go to the chiropractor too much? Can a person be over-adjusted? Let's see, so I go 2 times a week, even though my chiropractor tells me my spine is crap, and if I could, I should get adjusted every single day. So she has a condition called occipital neuralgia. So she says the adjustments take away the pain and feels great afterwards. I'm just curious if I'm causing myself long-term damage. So is that something you can address?
Sure. It's very difficult, if you know what you're doing, to adjust yourself not adjust yourself, but to get adjusted too often. I get adjusted pretty frequently. But I'm getting to be an old fellow, you know, I could actually use it. But getting adjusted 2 or 3 times a week by somebody who knows what they're doing is fine. Now, where people get into problems is when they start trying to adjust themselves, and they actually are moving the wrong bone in the wrong direction at the wrong time, and then it can actually start causing some problems. So, you know, there's been many times where I've had people that had a lot of acute problems or in a lot of pain, and I did see them 2 or 3 times a week, and sometimes even daily initially. So I wouldn't be too worried about that. I would demand results from my chiropractor. If you're going and going and going and you're just not getting any results, I would have a talk with him and kind of figure out if you need to change the strategy or possibly even look into seeing another chiropractor, because most chiropractors are all just a little bit different, have a little bit different techniques, a little bit different methodology, and I have found that it can make a huge difference. Hope that helps.
Yeah, good answer. And yeah, I think that in general, you know, it's important that we kind of just listen to our bodies and make sure that we're not, if we're experiencing pain, then that's something we want to address. And finding a good chiropractor is going to be a really important thing to do in making sure that we're getting adjusted properly. Okay, so we have another question. I know that chiropractic treatment can help with slipped and herniated discs, but when the discs have actually ruptured, can anything be done, or is it too late at that point? And this is Jonathan Tulloch's question.
Well, that is a really good question. Oftentimes, if the disc, we call it sequesters, which means that the disc is ruptured and a part of the fragment has moved away from the disc, and it's just a free-floating fragment around there. And if it's lodged against the nerve and we can't get it positioned off of there, no, that's a surgical situation that needs to be addressed surgically. But when a disc ruptures, oftentimes with conservative care, those things can even still resolve at that point. So as a matter of fact, I'm learning some new work right now on how to handle herniated discs real effectively. But even doing it properly can really take some time to get those people healed, because the disc material is very avascular and it's going to take some time to get that healed.
Wow. So another reason to take care of ourselves on the front end. So one of the things that Dr. Echols has explained in a whole lot of different videos is that by the time that we start feeling pain, and especially by the time that pain becomes so intense we just can't take it anymore, there is already so much damage that has already been done. So you don't want to wait until pain becomes your indicator, or at the very least, the minute you start experiencing pain, that would be the time to get yourself checked out and to get yourself looked at. Because at the point that suddenly you really can't take it anymore, the pain is so excruciating, you just can't make it through the day, chances are there's so much harm and so much damage that's already been done, you're going to be way worse off than if you'd seen the chiropractor maybe a year or 2 years or 5 years, depending on your situation, before the pain starts.
Yeah, that's right. It's kind of like waiting until your tooth pain is so bad you need a root canal, rather than just going in every 6 months and getting a good checkup and a good cleaning. It's very similar to that.
Right. And yeah, I think that's a really good, kind of analogy between the two. We can all sympathize with when one of your, teeth starts hurting, and, with pain in our bodies, it's never a good idea to just, deal with it or take a painkiller or, just try to ignore it, because those, pains in our body, they're only going to get worse. Alrighty, so the first comment that was left in here, I'm not sure how you say your screen name, Ajarian, maybe. So the question is, in the advanced chest massage with me and Greg, Gregory Gorey, it seemed like Greg was being very harsh when massaging you and looked like you were in a bit of pain. How painful was the massage, and how did it feel afterwards? So yes, anybody who saw that video, you saw the very painful looks on my face. And what I would like to say about that is, no, he was not being particularly rough. Definitely Greg is not quite as tender in his touch as Jen or Athena is. But the issue with that particular massage is that I just had so much tension. And so, these are muscles that I had never really gotten massaged before. There's just so much tension that even just the little tiniest bit of pressure was really, really, really painful. And yes, it felt so much better afterwards. It was crazy. So a lot of times, you'll hear people say, hurts so good when you're getting a massage or something like that. And that, issue arises that when you're actually getting the work done, sometimes it can be really painful, and especially if you have a lot of tension, it's going to be painful when it is happening, but will often provide a lot of relief later. And I'm thinking maybe this is something that you can touch on, because I know that there are a lot of times when you're doing like the pressure point kind of work, you'll just barely touch me and something will just be so tender and really painful, but a lot of times after you've kind of worked through that point, it's actually less painful. You kind of address that. Is that something you would say is?
Sure, exactly. Sometimes we hit maybe the point where a muscle will insert into the bone. And at first, if there's a problem there, it's going to be pretty tender. However, if you just hold that point for a few minutes, the pain will actually just go away. It'll just kind of melt away, and then that muscle is in a lot better shape and it's fixed, as we found out with you in the last video.
Okay, so here we go. Ken McMahon, not sure how you say your last name there, but Ken has a question. I have a compressed disc in my lower back. My old chiropractor would lay me on my side, cross my arms over my chest, and do the pelvic push. But after switching doctors, the new one won't do that because of my x-rays. I was like, it's not really a question, but maybe the question here is, why is it that maybe this new chiropractor won't do that same adjustment? Is there something that maybe he saw on the x-ray that indicated maybe he shouldn't do that adjustment?
It'd be impossible for me to really second guess either doctor in this case. I really don't know the case or don't know what's on the film. But I will say this. A lot of doctors, all doctors do everything a little bit different. And some feel perfectly comfortable doing certain adjustments with certain conditions, and others don't. And I have found, and this is unfortunate, but I have found that some of the younger doctors coming out of school, they have just scared them to death with the threat of malpractice, and even the slightest thing a little bit abnormal, they're encouraging the doctors to refer them out to, for a surgeon or whatever. And that's really unfortunate, because there's very few people that, I won't take or won't treat and be able to help them. So you just kind of have to find somebody that you're comfortable with and is willing to get in there and kind of fight with you to overcome some of those problems that you're having.
Awesome. So our next question, real quickly, Blondie Beauty. Hello, thank you so much for being here. She asked if I was drinking a kombucha. Actually, right now I have just refilled my kombucha bottle with water, but I do drink a lot of kombucha. It's a fermented tea that I highly recommend. It's definitely great, and it's fizzy. So for people that drink a lot of soda, I think that this is something really cool because it has that fizzy, effervescent thing that people do like about soda, but you actually get a whole lot of health benefits from drinking a fermented drink like kombucha. There's tons of enzymes, vitamins. It's just definitely packed with a lot of great stuff. I highly recommend it. Maybe we'll cover this in a future video, but I just wanted to quickly address that question. So
my wife makes kombucha.
Oh, she does?
Yeah, it's very good. She's quite adept at it, and it's a great beverage. Like you said, it's fermented, and it's good for you. Lots of probiotics, good for the gut, the bowel, the stomach. And I think, it was originally, from those mushrooms that get fermented, and people, they found that people that drink this just live a long time. So very healthful drink.
Definitely. And that's cool that your wife is actually brewing it herself.
Yeah. And it is a kind of an acquired taste, I think. It's
definitely a little different.
It's a little different, and I think, you just kind of got to drink a few bottles, and then you warm up to it a little more.
Yeah, and I'm at the point now where, with anything new that we try, every time that we, have a new flavor, a new taste we're exposing ourselves to, it's going to be a little different. A lot of times, things that are different, our first reaction is going to be, oh no, we don't want that. But just like anything, you can, I don't want to say get used to it, but you're just kind of are modifying your taste buds. For somebody who no longer drinks soda, on the rare occasion that I will have a drink of a soda, I'm like, ugh, God, it's so gross. Man, why did I ever drink that stuff? Because your tastes just kind of change. So,
yeah, it does.
The first time you try a kombucha, it may be a little bit weird. It may be something that you don't really like. But I'm at the point now where I crave this stuff. I really, really love it. I can't get enough of it.
You should probably make your own.
I probably should.
You want a wife to give you one of the babies.
Yeah, I have a huge glass jar at my house.
That would be perfect. That would be perfect, yeah.
Okay, so here we go. So somebody, Irish Buddha Filth. he has osteoarthritis in his right shoulder, and he asks, why are doctors so afraid to prescribe narcotics anymore? Doc?
Well, of course, I don't prescribe medications. I'm not a medical doctor. I'm a chiropractor. But in answering that, all I can say is that medicine is now one of the leading causes of death in the United States today, prescription medication. So it's not really anything to be just handed out like candy. It can be very dangerous and very damaging to a lot of the different systems. Anytime you take narcotics, it's damaging. It's damaging to your liver. It's damaging to your kidneys. It's damaging to the gut lining. And of course, it's addictive and it causes a lot of different kinds of side effects. And as Corrina mentioned earlier, it's best, if at all possible, to get the source of the pain corrected rather than just trying to mask it with a drug, especially narcotics, because they are addictive and you'll end up, being strung out on pain medications. And nobody wants to do that.
Yeah, you guys, I would definitely recommend, we recently put up a video called Pain Pills and Tips for Pain Management, where he discusses a lot kind of the problem with taking a painkiller, whether it's just something like Advil or Tylenol or whatever, all the way up to maybe your prescribed narcotic drugs, where you're really not addressing that pain. I really like how you say this. Pain is a signal. Pain is your body's way of trying to reach into your thick skull and say, hey, you up there, something is wrong, please help me. That's why we experience pain. So to just take a drug that's going to numb the pain or make you forget about the pain or whatever, that thing that is sending out that painful message, trying to signal you, is still going to be problematic. And chances are you have a problem that's just going to worsen if you don't address it. So please check out that video on pain pills, not to mention the addictive nature of narcotics. I can think of a lot of reasons why doctors would maybe hesitate to prescribe narcotics. And kind of as a secondary follow-up to that, there was another person that asked, can chiropractic help with osteoporosis? Or is that something that maybe would be dangerous for somebody who has compromised bone health?
Well, first of all, you realize that everything is controlled by the nervous system. All the hormone, everything in your body it's the master control system. So when somebody's got osteoporosis, I don't shy away from treating that at all. The chances of me actually breaking a bone are almost zero. They would have to be very, very brittle. Like there's some people who have osteoporosis so bad that their bones will actually break when they walk. They'll just break. Now, those kind of people, yeah, they're a little bit beyond what I would be willing to treat. But also, I'm a nutritionist, so I can help people to start building good bones. And it's not just a matter of taking more calcium either. It's a actually very complicated issue. And most people just throw calcium at osteoporosis and expect it to work. But oftentimes, it can cause even more problems, because it's not usually a problem of too little calcium. It's a problem that the calcium isn't being absorbed into the body properly. And that can be due to the fact that there's not enough acid in the stomach. There could be some enzymatic problems with digestion, not enough vitamin D, all these different factors. So it really needs to be kind of looked at more carefully than just throwing calcium at it.
Good answer. Okay, so Sweet Love Elmo says, I love my teeters hang-ups. Inversions and hanging upside down is great relief for my spine. What do you think about inversions?
Well, I think you said it. It gives you great relief, so there's a lot to be said for that. I actually have one of those in my house. I don't use it as often as I should. It's become more of a clothes rack than anything, but I do get on it occasionally, and I find it beneficial as well. I think certain people would need, an elderly person, I think, would need to be a little bit more cautious on it and maybe only use it with some supervision. If there was any kind of vascular episode or stroke that happened while you were on that machine, you would definitely want to have somebody there to help you get off of it and make sure you got the proper medical attention. But for most healthy people or people with just some lower back problems, I think that can be a very beneficial thing. You know, we've got gravity pulling down on us all the time. It's kind of good to take some of that stress and strain off of the spine and give it a little bit of pull in the other direction. I find it very helpful as well.
Awesome. I actually have never tried one of those, but I've always been kind of intrigued by them. And if they have the Dr. Echols endorsement, then maybe I'll give it a try.
Yeah.
Definitely, it makes perfect sense why that would give you a lot of relief. As you said, we're constantly, you know, gravity is constantly pulling us downward, downward, downward this way, so that inversion to kind of relax, relax and relieve the spine a little bit, definitely would seem to, like it would be very relaxing. So we have some comments here about DMSO that somebody uses for pain. And then David Sweeney also uses them under a fume hood to cryoprotect his cell cultures in liquid nitrogen. Sounds very, very complex, but thank you for sharing. So DMSO for pain, do you have any?
Don't have a lot of experience with that. I was actually looking for some the other day. I had some pretty sore muscles, and I was actually looking for some, but I didn't have any. But and I don't know that I've ever even used it, but I hear can be pretty helpful in those situations.
Yeah, I use arnica.
That's what I usually use.
You can find it pretty much any health store. You can take it orally, but you can also find little topical salves and lotions. But yeah, when I have sore muscles or after I've been working out or something, I go to arnica a lot of the time. I highly recommend it. Okay, Dissolved Girl 06 says, what are your thoughts on back clicks when somebody lies down and another person puts pressure on their back until it clicks? It's, I guess, kind of cracking someone's back.
That's what it sounds like. That's a really interesting question. You know, I kind of encourage people to get the help of a professional. Now, if you just kind of put some light pressure on somebody's back and they're really not in any pain or not having any problem, and it kind of clicks, I don't think you're going to do any real damage to that. The problem comes if somebody's got a real issue and a real problem, and then they try to duplicate some of the things they've seen me do on the videos, and we really encourage people not to do that, because although you're probably not going to paralyze the person or anything to that extent, you may not do them any good, and you may actually, cause them some harm. So if somebody's having problems like that, it's always best to just come see me instead of trying to do that. But yeah, just to push in a little light pressure on somebody's back I don't think would necessarily cause any problems.
Okay, Megan Rostein asks, what if the doctors can find no source of the pain, but it's still there and you have exhausted all your options? Are pain pills okay then?
Well, I would like to know what she means by doctors. Is this medical doctors? Is it medical doctors and chiropractors? Is it whatever else? I have found that there are so many different modalities for healing out there. Some of them are more traditional. Some of them are very untraditional. But I wouldn't even turn my back on the extremely untraditional ones, because I hear of miraculous healings taking place all the time with different sorts of energy work that people can do. It's just amazing. So don't give up. Keep pushing the envelope and looking at different things. Yeah, we have a saying, chiropractic first, drugs second, and surgery last, which I think is appropriate. But I don't like to hurt, and if I was in a lot of pain and I just couldn't take it anymore, of course I probably would take something too to help me out with that. But I think I would always continue to look for something so that I wasn't relying on that, because I know that it would be doing damage and it's not a real long-term fix. Mm-hmm. So I would always be looking for additional things, even if it's a little bit outside the box. I would give it a shot, because you just never know.
Yeah, I would definitely never give up and just say, oh, I'm never going to be able to know what the cause of this pain is. Just keep looking. And nobody really asked a question about this, but I think that this is a really interesting thing for people to know. It's been really interesting for me. Can you maybe talk a little bit about the pain referral system and how different organs of our body can actually cause physical pain in other parts of our body that seem unrelated.
Right.
Because I think that's, a really huge, has definitely, at least for me, been a source of my physical pains. And I didn't, ever realize that maybe the organs in my body could be causing that external pain.
Sure, exactly. One of the most common things we see related to that is problems with the gallbladder. The gallbladder is a little sac. It sits right under the rib cage on top of the liver here, and it stores bile, which is what is responsible for digesting fats in the body. And sometimes if we eat some foods that are not, our gallbladder that are maybe too fatty or maybe not the healthiest things, our gallbladder can kind of spasm. And when that happens, it can actually refer pain into the right back shoulder area up into the neck. It can sometimes cause headaches. Your neck and your back, you'll wake up. A lot of times people wake up in the morning and they won't be able to move their head. I actually had this happen to me the other day. And I immediately thought that my gallbladder probably didn't like something I ate. And I just put a little light pressure right here under the thing. And it was like, oh yeah, gallbladder. So, we took some steps and got that working. So, I actually just went and had an ultrasound done on my gallbladder just to make sure there wasn't any stones in there, and there wasn't, so that's fine. So my next step is probably to do a gallbladder flush, where any little sand or particles that are in there kind of gets taken care of and keeps that gallbladder real healthy. But we call that a viscerosomatic reflex, viscero meaning organ, somatic meaning muscle. And all of the different organs can refer pain to different areas of the body. So a lot of times people, if they get that right shoulder pain, they want me to adjust their shoulder or rub their neck, and because that's where it hurts. But that's not really where the problem's caused. And we always laugh. We say, when you step on a dog's tail, it's the other end that barks. So you don't want to. You wouldn't treat his nose. You treat his tail. So that's kind of something that you can utilize to help yourself there.
And correct me if I'm wrong, but basically the idea is that within the organs of your body, like your gallbladder and your liver and your stomach, we don't really have nerve cells in the organ to tell us if there's something wrong in that organ. You don't really go, oh man, my liver is really killing me today, or my gallbladder is really killing me. So in order for this pain signaling system to work, like we were discussing earlier, the organ will actually relay pain to another part of the body that does have nerve endings for pain, like our spine or our neck or our shoulders or whatever it may be. So it's kind of our body's way, our organ's way of communicating and sending us that signal that, hey, something is wrong, you need to address this.
I think if I stuck a needle in your liver, you would probably feel it, okay, or your gallbladder. We definitely have pain receptors in those organs a lot of times, like in appendicitis. I mean, you guys have terrible pain in the appendix, or your stomach. That's an organ. You can have terrible pain there too. But it's just so happens that the body is a whole thing. We think of it as muscles. You got muscles and you got organs and you've got this, and they're all separate. But really, the body is just one thing, and it's all connected. So when we have a problem in one area, it's connected neurologically to every other part of the body. So it's going to have an echo effect or a shadow effect, everywhere else as well.
Okay. Very cool. So yeah, guys, I would say if you are experiencing pain and it seems like the doctor can't figure out what's going on, like he said, just keep looking and finding other doctors, because a really good doctor is going to be like a undercover mystery man. He's going to pull out the magnifying glass and look around until he can figure out what's going on and how to fix it. And if you just keep looking, and I know that it can be really frustrating, but have patience and just keep looking, because when you find that perfect doctor, suddenly your whole life can change. The pain you've experienced your whole life could be resolved. So I just encourage you to keep looking for solutions.
It's true, and I had a lady that came to me just the other day, and she had already been to 9 other doctors, and she was continuing to have neck pain regardless of the doctors, and a lot of these were chiropractors, and she had gone to them, and I used a technique that was just a little bit different than probably she was had done in the past. And when I called her to check on her last night, she told me she was pain-free for the first time in, I guess years. It's been over the last 3 years. She's been to 9 different doctors. So keep looking.
Wow, awesome. Okay, so there've been definitely a lot of questions. Okay, so David Sweeney, can a chiropractor treat migraines? How many times would you have to go in for treatment for migraine headaches?
Well, the first part of that question is yes. That's one of the things I like to treat the most in my practice, actually. And the reason I do is because somebody who's having migraine headaches, I just can't imagine how terrible their life must be. I mean, I'm the biggest baby you've ever met in your life, and if I even have a mild headache, it's it's bad, much less a migraine headache. So I love treating people for those because when they go away, it just changes that person's life dramatically. So yes, to that part of the question. There's an old story about the very first chiropractor, Dr. D.D. Palmer, and this was back at the turn of the century, and somebody asked him that question, but it was concerning sciatica, which is pain down the leg. And they said a guy came in and he had sciatic pain, and Dr. Palmer cured him in 1 visit. So the next person that came up and he says, how long does it take to fix sciatica? Dr. Palmer says 1 visit. Well, it took him a year to fix that next person. So there's no formula. If you got migraine headaches, it takes 3 visits, and if you got back pain, it takes 10. Every person is different, and every situation is different. So we just have to assess it and go from there. Sometimes we get the miracle cure. It's 1 or 2 visits. Other times it's a real process to doing it.
Right.
And I might mention that diet can have a real big component to have migraine headaches. People can be eating foods that they don't even realize are triggering headaches, but they do. And one of the biggest, unfortunately, we find is chocolate. That's one of the biggest things that can trigger migraine headaches is chocolate. So check that as well. But more often than not, it's coming from misalignments in the upper part of the spine area, and it can also be caused by gallbladder issues. So there's a lot of different things that can cause it.
Right. And I think that's kind of an important, thing for us to understand. For any different, problem that we could be having, whether it's headaches or belly aches or mood issues or energy issues or inability to focus, there are a huge number of different, potential causes of, that problem or that issue. So it kind of brings me back to my the mystery solving, pulling out your magnifying glass and really looking at all of these different things, because as Dr. Echols pointed out, chances are it's not just one thing, causing migraines, for example. And certainly for all of the millions and billions of different people on the planet, their migraines aren't all just caused by the same one thing. So we have a lot of different options for addressing the different problems we're experiencing. Of course, diet and nutrition is a huge one. I talk about that a lot on this channel. Chiropractic as well is another solution. So just recognize that for whatever problem or uncomfortable thing or whatever it is that you're experiencing, there are a whole lot of different options and things you can look at in order to kind of figure out and get to the bottom of that issue. Okay, so Etienne Burton asked, where did that question go? Okay, okay, I can't find it, but basically his question was, I don't feel like there's anything wrong with me. Do you think it's a good idea to go to a chiropractor just in case? Oh, yeah,
that's a great question. I love that question, and I'm a little biased, but I would say yes. Because you could say that about your teeth. My teeth don't hurt, but should I go to the dentist? Well, yeah, you should go and have him check it out, because you may have cavities that you're not aware of. And if they're corrected initially before they're big problems, you can save yourself lots of money and lots of pain and root canals and everything else. So that's why children are great chiropractic patients, because if we can start adjusting their little spines when they're little, we can actually help their spine to grow up straight and tall and problem-free, rather than they're going to grow up with problems because they fall over off their bike, they run into the mailbox,
and we hunch over, we have bad posture.
They do all of these different things, and those are not going to always cause immediate back pain, but left there for 20 years, they're going to start developing back pain in their 30s, or sometimes 20s, sometimes 40s, just depending on the person. So if we can address those problems as they're young, we are able to ensure that that person is going to have a much better chance of, growing up straight and healthy and strong, because we are working with your spine and your nervous system. So I'm a big advocate of treating children for that reason. A lot of people don't understand that. They go, oh, they're kids, they don't have back problems. Well, that's the whole idea.
It's about preventing the back problems.
We prevent them. We don't want them, because if they're just left to their own, there's nobody who's going to grow up without having, any kind of issues. Everybody does. So it's best if we can do some preventative work beforehand. I've got kids in my practice that I've been seeing since they were literally born. And just growing up with chiropractic care, it's a great habit to get into.
Awesome. And, just as a kind of little addendum to that, I will say that when I started working at Psyche Truth and I went in to be a chiropractic model, I wasn't experiencing any pain. I mean, I guess my shoulders were tight, kind of the usual thing that almost anybody will say. But I wasn't experiencing any significant pain. I certainly didn't think there was anything wrong with me or anything like that. I was just, this is my new job and I'm going to be a chiropractic model. And sure enough, we get in there and he starts, kind of palpating around on my spine. He goes, oh, wow, you've got misalignments here, and he actually demonstrates that one of my legs, looked like it was longer than the other because my pelvis was kind of tilted the wrong way. So just to give you a really clear example, if you're someone who I wasn't experiencing pain, I had no idea that really there was, anything wrong or any misalignments in my spine, but, I get on the table and suddenly there's a whole lot of different things that he was able to address. And certainly I'm really grateful now to be in this position, because I do really see that almost every person on the planet, by the time that they reach their 40s or 50s, complains of some kind of back pain or this pain or whatever. It's just very natural for us to kind of, have aches and pains as we get older. But kind of doing the chiropractic work on the front end before you're experiencing the aches and pains is really going to go a long way to prevent you from ever having to experience that. So yes, I 100% recommend chiropractic treatment, even if you don't, especially if you're not feeling pain yet, because chances are if you don't address those issues, you're going to end up feeling pain, just because most people do.
One more thing about that. When I first got a chiropractic adjustment, I went to the chiropractor. I was in my I got adjusted a few times as a child, but when I really first went, it was in my early 20s, and I went because I was curious. I got acupuncture for the same reason. I just wanted to see what it was. I just wanted to see what chiropractic was. I didn't hurt anywhere, but my energy levels doubled. My energy levels went through the roof. I felt tremendous. And I didn't realize it at the time. I thought I had plenty of energy at the time. But when I realized my energy levels doubled, I was like, wow, see, I thought I was feeling great, but now I realize I really wasn't. Right. It was just my normal. So I kind of took it up to the next level at that point. And, a lot of athletes utilize chiropractic for the same reason. They need to take it up, even if it's only 1%. That 1% can mean the difference between the gold or the bronze.
Right. Definitely. Okay, very cool. So David Sweeney says, can a chiropractic treatment help with acid reflux? I have suffered from this for years without adequate relief from drugs. We actually filmed an entire video about acid reflux. It'll be going up sometime in the next couple weeks. But do you want to kind of quickly address
the answer is yes. The sixth thoracic vertebra controls the nerve supply to the stomach. Oftentimes we find that vertebra has shifted forward in the spine, and it puts pressure on that nerve, and it decreases the amount of the nerve supply that goes to the stomach. So instead of having 100% nerve flow, now we've only got about 40% nerve flow or less. Therefore, the stomach is not going to function properly. There's not going to be enough acid in the stomach to digest the food properly. It's going to start moving up into the esophagus and cause heartburn. So I remember I had one patient says, as long as you adjust that one spot in my back, I don't have no reflux. I have no heartburn. But if it gets out of alignment, then they have problems. So in my practice, I address it with chiropractic care, and we also address it nutritionally too by giving the person some natural enzymes and to help rehabilitate their and strengthen their digestive system.
Right. So yes, overwhelming. Yes, acid reflux is definitely something that can be addressed by chiropractic work, and of course, changing your diet, looking at your diet, but there's a lot of different things that can contribute to heartburn. The same thing I was just saying, in general, there's always going to be a myriad of different potential causes for those problems or that pain. So yes, chiropractic adjustments is one, looking at your diet, or even just, supplementing your diet, like you mentioned, with some enzymes, something to kind of assist your digestive processes. But just in general, heartburn is not something that we should endure. And if you experience heartburn on a regular basis, that's an indication that something in your digestive tract is not, working at its optimal levels, and something that can definitely be addressed. We should not have to live in pain. We should not just have to go, oh, I just have this pain and have to live with it. There's always going to be something you can do, some solution that you can reach out for. Okay, guys, so we're getting pretty close. We've got about 15 more minutes here, so be sure and throw your questions in now. Let me see, there was one that I was just looking at. Okay, Red Lily Petals writes, I suffer from lower back pain, which I know tends to come a lot from my flat sandals. I try to do stretching, yet I still have sciatic pain. Do you have any suggested stretches for the pelvic bone or legs? And I'll just kind of throw in there that, yes, when I wear flat flip-flops, I notice leg pain, and it's to the point now where it's almost immediate, after, I can wear them around the house back and forth a little bit, but once I've been, if I wear my flip-flops to work and I'm walking around a lot, I will experience this pain in my legs. And so my solution has been, I don't wear flat flip-flops anymore. I just, I'll show you guys my shoe. I have this little shoe that has little straps on it, but I think that the thing is that when we're kind of wearing the little flip-flops, little flat shoes, our toes have to engage to clasp around that little thing. And at least for me, I kind of realized, wow, this is not good for my feet. It does not feel pleasant. I like to have a little bit of arch in my shoe. I think that's really important. But do you have any comments on flat sandals or stretches that might help with sciatic pain? We do have a couple videos on stretches for sciatic pain, so definitely check those out as well.
Not really. I think just having some good arch supports in your shoes, and shoes can be big. A lot of times people's back pain will actually do a lot better when they get the proper shoes in there. But back pain can be a lot more complicated than just doing a specific stretch. I mean, if you've got spinal issues, you're not going to be able to stretch and just make them go away. You need to have those kind of looked at.
Right. That's not what I said. And then also, while we're on the subject of feet and putting arches in the shoes, there's another video that we have called, I think it's called Easy Exercises for Feet or something like that. But if you put in flat feet on our channel or just on YouTube, you'll find it. And essentially, there's this condition called plantar fasciitis, which is basically where the natural arch in your foot starts flattening out. And that can cause a huge amount of pain all the way up through your legs, all the way into your back. And so some people will get orthopedic insoles to handle that pain, but while that can be a solution that will help you in the short term, it's not really a good long-term solution, because essentially at the core of plantar fasciitis is just those muscles in the arch of your foot are just getting way too weak. So this video that I'm recommending, easy exercises for flat feet. Actually, it's a physical therapist, personal trainer, and she's showing you these little exercises you can do with your feet that help you re-strengthen those muscles in your arches. And there are people that, I mean, send her emails every single day telling her, oh my God, all the pain in my back has been relieved from doing these little foot exercises. So I think that that's something that I've started doing, and even for me, I go, wow, I'm actually running better now that I've been doing these foot exercises. So I would check out the sciatica stretches, check out those exercises for flat feet, and definitely, you know, seeking a chiropractor and, you know, having them check out your spine and everything is also going to be helpful. Okay, let's see. Are osteopathic physicians as proficient at manipulation as chiropractors? It seems like it's a secondary skill for a doctor of osteopath, but a primary one for a doctor of chiropractic. Is that something that you can address?
Yeah, and I think he's right. Most DOs at this point are basically just medical doctors. They don't. I don't even. Y'all can correct me. Somebody can correct me if I'm wrong, but I don't even know that it's actually part of their curriculum anymore. And if it is, it's a very, very small portion. Whereas with chiropractic, that's a lot of our curriculum is adjustments and manipulation. So there, back in the old days, around the turn of the century, osteopaths, that's what they did as well. They manipulated the different joints and really good at it. I've heard of some really good ones. But nowadays it's more of just kind of an aside. And as a matter of fact, most of the osteopaths I know won't do manipulation at all anymore. Okay. So it's pretty much chiropractic now. Cool.
Okay, so we're getting kind of towards the end here, so I'm going to combine some of these. Dissolved Girl 06 asked about irritable bowel syndrome, if that's something that can be helped in chiropractic. And I would say yes, probably. I mean, I would imagine that if you can address acid reflux, IBS would be kind of a similar similar thing. And definitely IBS is something that can be helped, obviously, changing the diet, adding some kind of supplementation in. We posted a video a couple days ago, foods, our food, and IBS was one of those. Food allergy and gluten, but really any food allergy her body is allergic to, IBS could definitely be a resulting problem. And then somebody else asked about asthma. Can chiropractic help with asthma?
Yes, and again, there's usually a big nutritional component to asthma as well. Oftentimes we think about dairy when we think about asthma, but again, misalignments in the spine, especially in the upper part of the spine, the back area, those go to the bronchioles and the lungs. And we've had children do really well with asthma, getting a lot better with chiropractic adjustments and then maybe making some modifications to their diet.
Awesome. And then Random Stuffs 261 left a comment saying that every morning when I wake up, I'm in pain. What's the best position to sleep in? And he's actually addressed this in a lot of videos where people will say, oh, I always wake up and think I'm sleeping wrong. And chances are there's actually some misalignments in your spine that need to be addressed by a chiropractor. And once you addressed those issues, then it's not the way you're sleeping specifically that's causing this pain. It's the problems with your spine, but all those can be addressed. On a side note, though, do you have any tips about the best position to sleep in? Or
Yep, sure. It's best to sleep either on your back with your neck being supported kind of like this backwards. You don't want your head being held up like this. They make special pillows with a hump in there, and then the head lays back. That keeps the curve in the neck. So that's one good thing you can do. Also, sleeping on your side. I like to use a big body pillow to hug like this. That keeps the arms from collapsing on themselves and having them go to sleep. If you're having back problems, you can, if you're on your back, you can put a pillow or even a sleeping bag rolled up underneath your legs to keep that pressure off the lower back. And if you're on your side, put a pillow between your knees. Often that'll help. But a lot of people, I hear this all the time. I woke up and my neck was, killing me. That is usually a problem with an organ rather than, they slept wrong or something like that. You don't usually go to bed and your spine unravels. It's usually caused by an organ that's reflexing pain back up.
Okay, so Dr. Caputo is in the room. Thank you so much for being here. And he asks, how do you feel about standard process supplements?
I love standard process.
I do too.
I love that because, I laugh and we joke around in my practice. Sometimes if a medical doctor was to give you the wrong pill, it could actually kill you. Even if they gave you the right pill, it could actually kill you. If I gave you the wrong standard process supplement, it would still make you better. That's what I love about it.
Nice.
It's made almost wholly of organically grown foods, so it's extremely safe and it's almost impossible to make a mistake. So even if I give you the wrong thing, you're still going to benefit from it. So I'm a big fan.
Awesome. And there was another question down here about how do you, tips for choosing a good chiropractor. And for me, I think that, a doctor of chiropractic that does sell the standard process supplements, I would say that would be a good indicator that this is a chiropractor who, has some good information about nutrition. I mean, as far as, I'm certainly not the utmost expert, but standard process I think is one of the just most top of the line supplements that are out there. So maybe those two things kind of go together. If you find a doctor of chiropractic that does sell the standard process supplement, good indicator. Do you have other tips on how somebody might find a good chiropractor?
Well, I think it's just important that you feel really comfortable and at home with whoever you get. There's different bedside manners, there's different personalities, there's different office procedures that you may feel, really good about, and others you may not feel good about. So don't be afraid. It's your money. It's where you choose to spend it. You should go somewhere where you really feel at home and have a lot of trust with the doctor that you're working with. I think that's very important. And if you don't find that the first go around, just kind of politely bow out and go find somebody that you do have a lot of affinity and can work with.
Awesome. All right, you guys, we have covered a lot of ground in this live chat. I really hope that some of this has been helpful for you. One last little question, and then I'm going to sing you guys a little song on your way out. There was where did it go? These questions come in so quickly. I sometimes have a hard time keeping track of them. Okay, so David Sweeney asks, what is the difference between chiropractic and a chiropractor and a physiotherapist?
Well, physiotherapists aren't really licensed to provide manipulation. So chiropractors are really the doctors who specialize in that. Physiotherapists are, they do physical therapy. They'll provide heat or cold or show you some specific stretches or exercises that may be of benefit to you. Chiropractors can also do physical therapy, but of course they can do the manipulation as well. That
awesome.
Answers that.
All right, you guys, thank you so much for being here, and I'm going to try and think of a song to sing you guys.
Freebird.
Freebird. I had a request. I'll have to save that one for next time. I had a request to sing something jazzy.
Sounds good.
So I'm going to do that. And,
Duck song.
the duck song? Okay, Mike requested the duck song. This is a song that comes from Brazil. It's in Portuguese. So all my Portuguese-speaking audience members will know what I'm saying. And this is the sound that a duck makes in Portuguese. Quang, 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 quang. Oh, pato, vinha cantando alegremente. Quang, quando a mareca sai de império, pra entrar também no samba, no samba, no samba. O ganso gostou da dupla e fez também. Olhou para cisne e disse assim: vem, que acordado ficará bem. Muito bom, muito bem. Na beira da lagoa, fora mensaia para começar. Tico, tico, no fubá. A voz do pato era mesmo desacato. Jogou de si na cama, o ganso era mato. Mas eu gostei do final quando caram na cliente saindo vocal. Quen, 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 quen. Oh, pato. Thank you all so much for being here.
Good.
We hope to see you all next week. Same time, same place. The live chat on Psyche Truth. It's time for live chat. Actually, it's the end of the live chat. Every Wednesday at 3 p.m. Central Standard Time on your YouTube machine. Live chat, the Psyche Truth live chat. See you next week. Thank you so much for being here.